On today's episode, we're so excited to bring you our conversation with Dr. Sonny Duong, a pediatric cardiologist. If you're a parent or expecting a little one, maybe that title alone makes you a little nervous. But don't worry. Today we're going to talk through what exactly a pediatric cardiologist does, when you might see one, if at all, and what to expect if you do. But not just that. We also talk about the lessons Sonny's learned from pediatrics that apply to his own parenting, like what he's seen in the neonatal intensive care unit and how that's translated to the sleep routines that he maintains for his own family. This is Getting Started with Baby, the podcast that brings you practical tips, loved products, and lived experience from parents who've been there. Brought to you by thestarterset.com, an upcoming service focused on helping parents find just the right things at the right time, personalized for their families. I'm your host, Jane Deshevsky, a mom on the other side of 2 under 2. I'm still actively figuring all this out, and I'm bringing you perspectives from across the parenting spectrum. Any opinions expressed in the podcast are personal and for entertainment purposes only. We encourage you to independently evaluate any content and consult with appropriate professionals as needed for your specific circumstances. Let's get into it. Welcome to the podcast.
Thank you so much. Appreciate you inviting me here to talk.
To get started, could you tell us a little bit about your background, your family, yourself?
Sure. I am a dad of 2 boys. They're aged 4, almost 5, and 1, almost 2. I live in New York City. I've been practicing as an attending pediatric cardiologist for the past 3 years. And before that, I was a general pediatric hospitalist for a couple years. And, we trained for like ever as doctors, kind of went through the whole training circuit in Pittsburgh and in California, and that's how I ended up in New York to do 1 more year of training and kind of stayed there.
And how did you get into pediatrics in general and then pediatric cardiology as a specialty?
As a med student, I really enjoyed working with families. I really enjoyed the population. It's a more vulnerable population. Kids in general obviously can't care for themselves. There's higher rates of poverty and disparities in that population. I was drawn to observing this somewhat underserved population. And also, in many ways, it's a field of highs and lows. So having a very sick child is one of the saddest things someone can ever deal with, but also there's a lot of joy in that field. Some people's happiest moments are in places like the delivery room.
I'm sure for many parents, they're not necessarily encountering pediatric cardiology regularly. Under what circumstances might you see a pediatric cardiologist, and what does a pediatric cardiologist do?
About 50% of my practice is dealing with patients that are born with a heart defect. And just to kind of put it in perspective, these are rare conditions in the grand scheme of things, but they're also conditions that require a lot of care when you're born with it. So it's a select group of potentially kind of high contact kind of patients that we deal with. Congenital heart disease is the most common congenital heart defect, but it still is only about 0.6 to 1% of all live births, right? So that's pretty low overall. And of those, only about a quarter of them are kind of the more significant type of heart defects that might require heart surgery. And then maybe half of those are the types that could potentially be life-limiting or life-altering. But when you kind of crunch the numbers, it's about 1 in a couple thousand or 1,000 have a very significant kind of issue that they need a pediatric cardiologist for. The other 50% of the practice are patients that have acquired heart disease or in a category that we are kind of making sure that they don't have heart disease. And that's where a lot more people have made contact with the pediatric cardiologist. So we do a lot of screenings for heart disease, right? Because it is the most common congenital heart defect. This is something that's typically picked up when a doctor listens to your chest with a stethoscope, listening for what are called heart murmurs. So something that we see often are someone's primary care physician or pediatrician has heard a heart murmur and they want to make sure that the patient doesn't have a heart defect. So it's a common reason to see a heart doctor. My specialization is in imaging of the heart. And so we do ultrasounds of the heart and ultrasounds of fetuses in utero. Fetal screening for congenital heart disease is also kind of a big part of my practice and the practice of many pediatric cardiologists. The reason why that's important is that there's a lot of evidence that shows that if you can identify a serious heart condition early, you can put into place the mechanisms needed to best intervene successfully after the baby's born. And also is very educational and important for decision making for the parents too, to know
Yeah.
that ahead of time.
Is that becoming more common to do fetal echocardiograms?
There's a lot of reasons to be referred for a fetal echocardiogram, and a lot of people might not know they're getting one because their OBs might be doing them too, because that's kind of there's the kind of variations in practice, kind of nationwide, and so some people might not realize when they're getting an anatomy scan, they're getting a more in-depth look at the heart than some other OBs might be comfortable with. But in general, there's a lot of what we call indications to look for congenital heart disease. Things like medication exposures are a common reason for getting referred for one. Having a family history of congenital heart disease is another common one. And sometimes when the obstetricians are just having trouble seeing the heart, which can happen because people come in different shapes and sizes, and sometimes it's hard to visualize things, they also can get fetal echocardiograms for that. There's a whole slew of other things like having diabetes, requiring insulin injections, et cetera, other conditions that would lead you to need to get a fetal echocardiogram. So it's that a fair amount of people do end up getting fetal echocardiograms for the baby born, especially in today's era where it's a lot more accessible than it used to be. This is kind of nerding out stats stuff, but say if something has more than a 3 times risk of a baseline risk of having congenital heart disease, then you should probably get a fetal echocardiogram. And so if the baseline risk is 0.5% or 1%, then if you're referred for fetal echocardiogram, it means your kind of pre-test chance of having something might be something like 2 to 3%. And that's still a low percent. Okay. So we've decided from a public health initiative or perspective that if a 2% chance is high enough, it's worth getting a fetal echo. It still means that 98% of the time there's nothing found. Just because you're told that you need to get screened with a fetal echocardiogram, you have to understand that the risk of there actually being something is still thought to be pretty low. Unless they're doing an anatomy scan, which all babies get these days, and they see something that they're concerned about, right? So if you're getting referred for a reason other than just a routine indication for screening. Does that make sense?
Yeah, that does make sense. And it's helpful information to have because even getting an extra referral to something is already in itself anxiety inducing during everything makes you anxious.
I see that. I see that every day. Parents can come in like 2 flavors. One where they hear the word, "Oh, it's just a screening," and modern maternity is tons and tons and tons of tests. So it kind of just like it's just an add to the bucket. And then some people get very anxious about it, and it's partially, I think, how OBs communicate to their patients that leads to that as well.
Yeah. And it is pretty common, I think, to get referred for this for IVF as well.
IVF is a very common indication for fetal screening. Yep, echo screening.
Is there a reason in particular that IVF ends up being a more common reason screening?
So we don't actually know why precisely. There's a higher rate of congenital heart disease in IVF, but there is. So it's from a public health perspective been decided that all IVF patients should be screened. And so that's a very common reason.
So you mentioned you have 2 kids. How did becoming a dad impact how you think about your work?
Yeah. So I think if you're having a first-time child and you're getting introduced to the kind of world of pediatricians and all the rules or recommendations around having a baby, it can seem random, maybe, especially if you don't have a medical background. And, the job of the pediatrician is to relay these recommendations to you because they're based in science. Something I didn't realize is that when I was doing this before I had a child is how hard it actually is to do some of these things that I'm recommending to the parents. So it's given me a real appreciation for something like you're prescribing a medicine, right? And you're like, okay, well, here's a 3 times a day medicine. Okay. That
Oh boy.
seems just so easy to write down, right? It's the hardest thing in the world. And what if you say, got to take it before food and not 1 hour after a meal? It's like the hardest thing for a parent to do, especially when you have a baby that's feeding every 3 hours or 3 meals, 2 snacks a day kid. That type of thing is totally lost on young pediatricians who don't have kids. And so now I have a much greater appreciation for that type of thing. So I'm not in any way diminishing the recommendations that organizations like the American Academy of Pediatrics make because they are important. I do follow that from my own shoulder, but I have a greater sense of why it might be viewed as hard to do some of these
Yeah.
things.
I think that's such a good and generally applicable point because I can't even get my kids to take like Tylenol even when they might need it, right?
Right.
What about the other way around? Have some of the things that you've seen as a pediatric doctor that impacted the kind of things you bring to your own parenting at home?
Yeah. Yeah. Oh yeah, I mean, it has improved empathy and communication, definitely. Having your own child.
Yeah.
And then I do take a lot of the lessons I learned as a pediatrician home. I'm like very strict about things like sleep and feeding. In med school, this might be a trite statement, I think, but in med school, one of my mentors, who's a pediatrician, said the key to parenting is limit setting and consistency. And I find that to be one of the most challenging things to adhere to, but it works. And the reason it works is that kids are super flexible. They'll get used to any sort of environment you kind of put around them. And so making sure it's very clear that they know the boundaries of their behavior in the environment, and then limit setting, making sure that it's known every time they cross that boundary, they can adapt to that. Almost all children can adapt to that, maybe more than a new time parent might. That really applies to me, my parenting technique around sleep. I think sleep is an area that a lot of parents have trouble with, and perhaps I'm just lucky, and maybe I am just lucky. Maybe I'm coming at this from a very privileged standpoint of having 2 children that were pretty good sleepers. Applying the philosophy, though, of limit setting and consistency means things like very consistent bedtimes, very consistent bedtime routines, very consistent controlling of the environment in which they're sleeping. So things like noise machines work very well, consistent swaddles, consistent beds, no co-sleeping. Those types of things really, I think, can put babies, which are in many ways, in my opinion, like very young babies under 2 months are like little bags of reflexes, can put them in essentially mental states to get ready to, that's something that you learn like in the neonatal ICU, for instance. The NICU is super, super regimented because there's one nurse taking care of 5 babies and they do it all the same and on a schedule all the time. And that's how they get through that. And taking a little bit of that, I mean, of course, more human than that, but taking a little bit of that philosophy.
So you took that away just from your experience working or observing the neonatal care unit, just that consistency really does, routine and consistency really does have a positive effect.
Yeah. Yeah. I mean, it's almost a trite statement, but kids really do need consistency. Little infants, toddlers, young children in particular, they really need consistency because they need to know where the edges of their world are, so to speak, so that they can operate well within that space, in my
Yeah.
opinion.
Well, going back a little bit more into kind of pediatric heart issues. So we talked a little bit about how they're detected often even in utero. You mentioned that in a lot of cases, it's actually 50% detected sometime later, sometimes at the pediatrician appointment and then referred. What are some of those things that can happen where it wasn't detected in utero and it develops later?
Fetal echocardiogram screening is remarkably good at catching most major congenital heart defects. But
Mhm.
there are categories of heart defects that are commonly missed. Okay. So more commonly missed, I should say. So whenever you get a fetal echocardiogram, there's like disclaimers all over the wall. And like one of the very first things I say is that everything looks normal, but there's a list of things that I can't really tell you are absolutely normal because there's limitations of technology, right? I go into that disclaimer pretty quickly because the types of things that can be missed are changes in structures that are normal in fetal life, but then are supposed to go away in childhood or infancy after birth. Those types of structures sometimes don't go away. They can leave holes in the heart or kind of extra vessels where they're not supposed to be, or they can leave narrowings in vessels that you couldn't tell were there before because there was other structures that were there before, essentially. You can miss other holes in the chambers of the hearts. Anyway, those types of things tend to be less serious in terms of the implications for the prognosis. And they tend to be the types of things that can resolve on their own without any sort of intervention at all. So having a fetal echocardiogram that is normal greatly reduces the chances of significant congenital heart disease. Okay, so nothing but reassuring. But, it is possible that after a baby's born that a pediatrician will listen to the baby's heart and they might hear a sound that they don't usually hear, a heart murmur, and that might end up with a referral to a pediatric cardiologist at that time. Most major congenital heart defects are present in the first couple months of life. So after about 6 months, a year, the chances of picking up all of a sudden very serious congenital heart defect is pretty low.
In the event that something is detected, obviously that can be a really scary moment for parents. What ends up happening? Where do they go from that diagnosis, and what can they typically expect?
The things that need to be relayed to a parent in those situations are the expected prognosis, okay, because there's a wide range of possibilities, okay. Congenital heart disease can have a very wide range of presentations, right? So there's some that are life-limiting, some that require multiple heart surgeries, etc. And depending on kind of the resources, life stage, etc., there can be consideration of whether it's futile to intervene. It can be that extreme, right? But it's usually not like that. So those are the hardest conversations we can have. It's usually more like there are repairs, there are congenital heart repairs, right? So those require usually heart surgeries or sometimes, more rarely, cardiac catheter procedures that can help or alleviate whatever the issue is. Again, I'm being very vague because there's a very wide range of potential defects out there. But if there's something that requires an intervention, the next step would be to meet an interventionalist, like a cardiac cath doctor or a cardiac surgeon. Okay, so I'm not a cardiac surgeon. I look at pictures of the heart and make diagnoses, but there's a whole team, a heart center team at a lot of medical centers that care, in an interdisciplinary fashion for patients. So that would be the next stage if there was something quite serious. There's a bucket of disease where we can't tell right away if something needs to be done, and there's a chance that during growth, it will declare itself within a year or two or three that it needs to be fixed. That's very common with holes in the heart, for instance, which are a very common heart defect. It can sometimes go away on their own, sometimes they don't, right? So that's something that you might wait and watch and see for a while, depending on the age of the patient and when it's diagnosed. To be super vague but true about your answer, it's either is referred for an intervention or continuing to watch.
It sounds like the urgency can also vary.
So outside of the fetal period, there's very little that's so urgent that you would need to make need a heart surgery within a couple weeks type of thing. So outside of the very young newborn age, and so that's why we do all this fetal screening to make sure there's nothing very emergent. Because if there is, then we're ready for it, and then we have a plan for it when the baby's born.
Even so, I imagine that being on this journey as a parent is probably fairly stressful. Are there things that you have seen are helpful for parents trying to manage the stress and anxiety of an experience like this?
It's helpful to meet a parent that has an older child, at least 5 or 6 years that maybe been through the heart surgery. What I hope you'll find is that the parents are doing great, right? The kid's doing great. They have a great family. They went through it. They got through it. There's a scar on the chest. Going to grade school. We're doing all the things. or happy active child. 'Cause that's usually how it is. Most heart centers have social workers and teams of people that are really good at plugging people into the resources they need to get through this. Because it can be, depending on where you live, it can be a long time in a hospital far from home if you're not close to a surgical center, because those places are not all over the country. Getting resources for you to be able to get through all that, that's what we're all here for.
And I imagine in that situation, having that staff at that heart center or social work to navigate all of that complexity is probably pretty useful.
Yeah. I mean, it's a key part of the interdisciplinary heart center, because by nature, pediatric cardiology is personalized. Every heart defect's a little different. It requires personalized solutions and personalized care. And so, there's a lot of centers out there, but the ones that function well really build teams of people, which might be a little different than other people's experiences with the medical care system, because, they go to one doctor to get their surgery and then they don't ever see them again, right? That's not how it is in heart defects, which are a lifelong condition, which require many different minds thinking about the problem.
So if there was one thing that you wanted somebody to take away from this conversation, what would it be?
If you are referred to a pediatric cardiologist, first of all, take a breath. It's going to be okay. We're going to get through it. Okay. The chances are overwhelming that most referrals don't have a significant issue, and that the ones that do will work through it. If you find yourself in need of pediatric cardiology, I guess the kind of a side note that I'll say is that, there's not pediatric heart centers everywhere, right? So finding the right teams of people with outcomes that, if you do need a surgery with good outcomes, is also something that is important to think about as well, because these are conditions that are highly specialized and require specialized care. And so going to a specialized center, I think it can result in very good outcomes.
Yeah. Well, thank you so much for sharing that. I think that's going to be super useful information for parents out there, and I really appreciate you taking the time. To learn more about congenital heart disease, you can check out the CDC website on congenital heart defects, cdc.gov/heart-defects. We've included the link in the episode notes. To keep up to date on our episodes, follow this podcast or find us on Instagram at @thestarterset_baby. Know someone who needs to hear this episode? Please pass it on. Thank you for listening. Till next time.